I've been asked a question about staffing levels for a DPC practice. And the staffing levels, let's talk about where the staff is. First of all, you have no billing department, okay? You have no coding department, no billing department. I tell people, I get paid every night at 2 o'clock in the morning, money from those my patients' checking account. Well, actually, usually it's credit cards, but checking card or credit cards gets dumped into my account. There is no billing department. All right. The software, in fact, we're developing software right now with Twin Oaks and Amazing Charts to marry that, so it will be all automatic for our DPC franchises. But make a long story short, there is no billing department. All right. That saves 30-35% right there on your staff. All right. The second thing is that the DPC practice has a lot less patients on their register. The average practice for a primary care doctor today has 2,500 to 4,500 patients. That's what they need to keep their doors open so they can make enough money. That's one of the reasons in our town there's only, I think it's 8.3 minutes of patient-doctor contact time with their primary care doctor. It's a totally different practice with a DPC practice. You know, we have, in fact, actually one of the largest direct payment practices in the nation. In the morning, I see 5 patients often, 6 patients, totally different kind of practice. Most DPC practices are seeing 3 to 5 patients in the morning. They end up having 1 or 2 staff above the doctor at most. So it's a totally different kind of staffing, which cuts the cost down phenomenally. And that's the neat thing about a DPC practice. You can run it, they can be started on a shoestring. Number 2, if they're built right and marketed right, they can grow phenomenally. And you don't get, for most practices, the more patients you get, the more staff you got to get, the more billing department people you got to get, and we have all these delays in accounts receivable. That doesn't happen in a DPC practice. It just doesn't happen. If every night those credit cards and checking accounts get dumped into the DPC practice account, it's all done on paper. We know the next morning where we stand totally. There is no accounts receivable. There is no billing to send out. There's no mailing. There's no stamps. There's no envelopes. There's none of that. So there's all these things drive down the costs of running a DPC practice. Whereas primary care practices, a normal insurance-based model, the costs are going up and up and up, especially when you start to look at all the insurance requirements, all the billing requirements, and all the macro and all these other things for Medicare. It's just driving the doctors crazy because they have to add more staff, more time, and it's a never-ending thing, and it's going to get just worse over time. So that's why I love a DPC practice.